Alejandra Gonzales is a Bolivian economist and a current Chevening Scholar doing an MSc Environmental Economics and Climate Change at LSE. She's a researcher at the Bolivian Socioeconomic Research Institute and a researcher for the last 4 years at the Sustainable Development Solutions Network at SDSN. She is author and co-author of the Living Wage Coalition Project and Tourism as an Engine for Sustainable Development in Bolivia. She worked as an international consultant for Flasco, Chile, concerning SDG 3. She was chosen as a sustainability leader for an immersive training in the USA.
Can you hear me? Yeah. Okay. Thank you so much for the invitation. First of all, small disclaimer. I'm not. All the presentation is based on my previous work, so all the opinions are mine and not. They are not referred to my previous institutions where I used to belong. So the presentation will be about the impact on welfare in Bolivia in a state level. The goals of the presentations are that, first of all, I'm going to provide a context on some of the socioeconomic and political implications in Bolivia during COVID. I will describe the heterogeneity between the regions in Bolivia and highlight the importance of subnational data. I'm going to present the results on the impact on welfare from a state level. Bolivia geographically is divided by departments, but I'm going to use state level. And finally, I'm going to give an overview in terms of the indigenous groups. Bolivian context. So Bolivia is considered one of the poorest countries in South America. The SDG index from Bolivia says that approximately 40% of the households live in extreme energetic poverty, and 40% also lack of basic services. Around 70% have informal labor have an informal labor market, and of course, having these underlying conditions, the health system is fragile. The education system is non-technological, so this affected a lot during COVID. And something very important is that before the pandemic, Bolivia was facing a very hard political situations. The economic system stopped for over a month with strikes in November 2019 due to elections, and we had a transitional government from that point that was supposed to call two elections in April, but of course the pandemics came, so the elections were at the end of that year. That means in October. More about the Bolivian context. So this map in the left shows the unsatisfied basic needs. The red part is when more than 50% of the population face these unsatisfied needs. And in the, well, that's your left, my right, your left. I call it a distorted map. This shows the size of the municipality does not show the geographic extension, but the amount of population. So you can see that although the other map shows like everything is kind of like red, the demographic can show a different perspective. Another interesting fact about Bolivia is that topographically it's very different. We have the Andes that its altitude, it could be almost 4,000 meters above the sea level, and this was a very important fact because of COVID, since COVID was a respiratory disease, and in that part of Bolivia, of course, we face lack of oxygen. Compared to the east side, the altitude is so much less. So, as we can see, there are huge differences in terms of geographically, demographic, and socioeconomic aspects. In terms of development, this is, Bolivia, it's right in the middle according to the SDG index. This is previous to pandemics. However, this is the SDG index taking into account subnational data. So here we can see that the national average, it's, for example, in this case, 62.7, but almost the rest of the municipalities are below that. So we can see that it's a very unequal country. Um, One of my main highlights here is that the importance of subnational data, because even in one country, things can be very, very different. This kind of data allowed us to, well, my institution to build a COVID-19 vulnerability index that it mainly covered three aspects. The first one was risk of rapid spread of the virus, taking into account, I'm not gonna go into all over the details, but some of the variables that were used were infrastructure, for example, roads, migration, or overcrowding rate. The other dimension taken into account was the underlying health situation. For example, the obesity level, population over 60, or different pathologies like IVH or tuberculosis. And the third dimension that was taken into account was access to basic services, electricity, water, sanitation, internet. People that do not speak Spanish, because in Bolivia, around 50% of the population is indigenous, and other variables. This is the result of the vulnerability index, and once again, you can see that heterogeneity. This vulnerability index can characterize the capacity of municipalities for the containment of the pandemics, and was used as a basis to better decisions when to call for the next elections. This also can allow to prioritize efforts according to underlying conditions, the ones that I have mentioned before. And also, as I've been saying, it shows big heterogeneity between municipalities. Oxford has constructed this stringency index, and Bolivia, it's a very interesting case because with the change of government, the policy completely changed. The first 8 months of the pandemics, the average of this stringency index being 100, the most stringent, Bolivia got a punctuation of 88.3. Compared, for example, to Peru, that was 85.4, and the UK 69.5. So the restrictions were very high in Bolivia. Those are some of the metrics that were used. For example, school closures, workplace closures, stay-at-home requirements. So in Bolivia, we can see that in the first wave of COVID, the mortality rate was very, very high. And this was despite the high restrictions in the country. And in the second and third wave, the mortality rates, despite these restrictions were more relaxed, the rates of the deaths didn't grow so much. We can attribute this to the vaccination, not really, because the massive vaccination started at mid or end July, and the second wave was before that. Maybe we can have this for discussion, but this could kind of like show some evidence about what was the really impact for the restrictions. So in the study that it has been published, that I'm co-author, its name is Life and Death During the First 6 Months of COVID. We try to measure the impact of mobility policies in terms of year loss. We measure it in two ways: the excess death and the quality of life. Bolivia stood out with the highest levels of overmortality and have suffered sharp reductions in mobility, compared, for example, to Denmark, that did not suffer many restriction or excessive deaths during the 6 months, the first 6 months. One of the conclusions of this study was that there is a slightly negative correlation. That means that extremely rigid confinements did not really help reduce mortality. This graph, we can see the results. So Bolivia, it's over here. And for example, here is Denmark. So the more for your side, the more right you are, it's how rigid are the confinement, and the more left, it's that the restriction weren't that high. The upper, it's the amount of deaths, the excess deaths that we have used in the study. So Bolivia, despite having these huge restricts measures, the deaths were still high. In the first year, the excess of deaths globally vary between minus 300 and more than 4,000. And in Bolivia, the difference were also big. For example, in La Paz department reached more than 5,000 excess deaths. That's even way higher than any other country in the world. And it's 5 times the least state. In this graph, we can see the results from state level. The upper one is La Paz, the state of La Paz. And compared to the least one, that is Tarija, as I have mentioned, it's even 5 times higher. So this is the results in a state level. However, in this case, we weren't able to prove any kind of correlation. Maybe it's because of the change of policies, because the first 8 months, as I've been saying, for example, using the Oxford Stringency Index, the punctuation was 88.3, and in the last 4 months were 34.3. For example, we have the state of Chuquisaca that had very high restrictions, but and also very low excess deaths. On the contrast, we have, for example, Pando that didn't have very high restrictions, but also have low excess deaths. Now, in terms of welfare, for example, in Sweden, 1.2 of deaths were in people under 50, and 69 were in people over the age of 80. In La Paz, in the state of La Paz, 60% of the deaths were among people under 70 years old. In this study, their self calculates the years of life lost for a COVID death, so we use this estimation. And through that, we were able to estimate that, it was able to estimate that in the La Paz department, La Paz has lost almost 60 millions of days, or 20.5 days per person. That's in terms of welfare. And only one country has lost more than La Paz. That was Peru, that lost 25 days per person. In terms of quality of life, impacts were not homogeneous. The most privileged ones and isolated versus the rest, 80%. So the privileged one and the most isolated didn't suffer that much compared to the rest of the population. On average, Bolivia suffered a mobility reduction of 41% the first year, and a loss of average of 150 days per person due to mobility reduction. So in this graph, we can see the total welfare analysis. The red section shows the excess deaths, and the yellow one, the quality of life lost. And we can see that the biggest loss come from the loss of mobility rather than the deaths. For example, even in La Paz, that La Paz had the most deaths. It's 7 times more days lost coming from mobility restriction than the deaths. And to conclude, I'm about to finish, about the indigenous communities. So although they were isolated, at the beginning they were not very affected. However, because they had less interaction with the disease, unfortunately, there isn't a lot of data in terms of how they were doing specifically. However, there are some national coordinators that were able to raise some data. Another insight about the indigenous communities is that despite some policies, for example, Bono Familia, that was supposed to give some economic incentives to the most poor. They weren't specifically economic measures for the indigenous people. So also the indigenous peoples were affected because as people were saying, some things were being opening, for example, restaurants or to protect, to like promote the economic activity. But for example, in terms of national parks, in order to protect the indigenous people, the entry was still prohibited. So that also affected their income. We could see an absence of state measures in terms of for the indigenous communities, and something that was very concerning at that point is that indigenous people at some point had to deal not only with COVID but with other things like mining, deforestation, because these were intensified due to the reduction of control because of COVID. Some of the conclusions are that disaggregated data, it's important to better understand the context and for more informed decisions because of, in the specific case of Bolivia, because of its heterogeneity. We need to consider beyond municipalities and try to have data in terms of indigenous territories. Mobility reduction might have been more costly than the benefits it provided. A total and uniform quarantine was inefficient because it affected the poorest. They either non-quarantine or die. Education, for example, in terms of education, because most of the people didn't have good access to technology and also affected household incomes. It could not prevent the spread of the virus, the quarantine. And to finish, indigenous faced other challenges apart from COVID. The importance, it highlighted the importance of unions and associations, and that for future it's important to consider policies that are specifically directed to indigenous people, considered their culture. Gracias.